And one of my friends, how are you? I thank you for joining us in the house. It is the one and only Douglas Carswell, President, CEO, Mississippi Center for Public Policy. Well, I knew it wasn't the fog that curtailed you a little bit, because you'd be used to the fog. Is it really that bad across the pond?
I won't tell you how bad it is across the pond. I will just say it is wonderful living in a part of the world where the sun is normal rather than a rare exception.
Yes.
In London, when the sun appears, sometimes it causes mass panic because there's they think it's a UFO of some kind. But it's lovely living in a part of the world where it's often so sunny.
All right, I got a quick shot here for you, and this is the opening quick shot. A British bus company uses sheep urine to reduce city smog. A chemical in the urine converts part of the fuel exhaust into non-polluting the nitrogen and steam. Would you know anything about that?
I would not know anything about that. All I would say in defense of my country is they did some wonderfully inventive things during the Industrial Revolution, and if they're reduced to trying to use
sheep urine,
sheep's pee to try to make the world a better place, good luck to them.
Well, if it works, it works, I guess. But I mean, that's
they're very inventive people.
I'm not sure how many sheep it takes to do that. I guess it depends on the amount of fog, but I'll let them worry about that. Good report. By the way, you guys are doing some yeoman work over there at the public policy, and kudos to you. You revealed that the state has some of the highest paid public officials in America, as well as having a state superintendent for public education. You said 300,000. I think that's down. It was more than that at one time, wasn't
it? I think that's right. And to be fair, there is there's a vacancy, and they're looking for someone. So the precise details of the new package of the new person to be decided. But what we do every year is we publish basically a simple list. It's a list of the 50 highest paid public officials in the state of Mississippi. And we do this because we think the public has a right to know. We're not criticizing everyone on the list. There are some highly professional people who do a good job. But I think if you look at the list, it would also raise a lot of questions. A lot of people might ask themselves, why is it, for example, that we have a school superintendent from an itty-bitty school board district earning nearly $250,000, which is not just more than the governor of Mississippi makes, it's more than the governor of Texas makes with a population of 30 million. So,
which district was that?
Well, there are three districts, if I recall correctly, where the school superintendent is on. In Corinth, I think they make $250,000. In Tupelo, just under $250,000, and in Hinds County, $225,000, not far off.
Yeah, here's what I hear on this a lot. If you're talking about Madison County, DeSoto County, you've got a lot of children and a pretty big plant under you.
Yep.
It's hard to question the salary of somebody with that type of responsibility. But I do agree with you in some of these smaller areas where the tax base is terrible, where the grading is near F.
Yep.
We do have a problem there.
Yeah, and at the end of the report, we've actually got a table where we do exactly that. We look at the number of students in the district and the grades that the district is getting, and then do an analysis to see if the salary is worth it. And clearly, there are some school board districts, Harrison, Madison, Rankin, DeSoto, very big school board districts, very good grades. And I think there's an argument you could make that, the taxpayer is getting good value for money. But an awful lot of these districts, there are a couple of school board districts where, you've got a few thousand students and the governor, the school superintendent is making more than the state governor. Clearly, I think we need to have a conversation about how we make sure that money that is in the system for education doesn't just find its way into bloated local bureaucracy.
I just tweeted that out at X-Twitter at Fat Cat Salary List here, and it'll take you directly to the page, and you can go back and look at some of the salaries there and see what your superintendent makes for the most part. Timahaw County in Starkville, $185,000. That's a lot different than some of the other people on the top. So let me take it the other way, Douglas. I've always thought this. I think the salary we pay our governors, regardless a political party is shameful. I mean, as a chief executive in charge of a several billion-dollar plant, he ought to be paid more than that. I could see $300,000 or $400,000 a year. Your thoughts on that?
I think there is an argument that the governor salary in Mississippi should be raised.
Yes.
But it's not my job to advocate for spending more taxpayer money. But I think logically, if you're going to have good governance, you need to make sure that the most senior elected, not just the senior elected official, not just the governor, but some of the officials have a salary that is competitive. I mean, there's a saying in England that if you pay people peanuts, you get monkeys. We need to make sure that we pay our public officials well. But I think this report is really looking at some of the fairly no. If you run a local school board, your job is not comparable to that of the governor, and yet you're often earning a significantly larger amount than the state governor.
What does the governor? I don't see it on here. What does the governor make?
He's roughly on, I think, $125,000 now, and that's going to go up next year. But it's not going to go. It wouldn't even put him on this list next year with the increase. He'd need to be making $170,000, $180,000 to even be on the list of the 50 highest paid public
It's
officials.
crazy that he doesn't make as much as the superintendent of education at $300,000.
Yeah.
He or she for the future. It's just because you're right. I mean, ultimately, you're going to have people who are very talented, entrepreneurs, great business people, great people, and they're not going to leave that position to come work for $125,000.
I think a lot of the key in all of this is accountability. If you give the state legislature more oversight in setting salaries, I think you could begin to have a reasonable, sensible conversation. One of the recommendations we make in the report is that actually public officials working at a state level, there needs to be more oversight from the legislature in their salaries. And I think if that happened, you would begin to have a sensible resolution of this. People would recognize that the governor should be worth more in terms of the value they bring to the taxpayer than the school superintendent of a very small school board.
You guys have been mulling the numbers and also listening to this narrative on Medicaid from the Center for Public Policy. What's your thoughts on this?
I'm not in favor of hosing federal dollars to try to fix problems. If hosing federal dollars fixed problems, then we wouldn't have ingrained intergenerational poverty. All the welfare programs set up under Lyndon Johnson would have been wound down because they would have done what they were meant to achieve. I'm not in favor of simply expanding the federal budget to try to tackle some of Mississippi's health problems. But I do think there is a real problem in Mississippi, and that is healthcare is simply not affordable for a large number of people in the state on fairly modest means who don't qualify for Medicaid. And I do think we need to think very hard as to how we can do something about that. And one of the things I think we need to do is remove some of the restrictive practices that artificially inflate the cost of healthcare. These are the so-called certificate of need restrictions, and very complex and technical subject, but basically there are these laws that prevent a new healthcare provider coming into the market and competing with an existing provider. Now, you think about where you get your groceries. If there was a law that prevented anyone from competing with a grocery store in your district, it would inflate and push up the cost of groceries. We've had that system for healthcare in Mississippi for 30 years, and this is why healthcare is largely unaffordable to many people on modest incomes. We need to change that. We need some fairly far-reaching reform to remove those restrictive practices.
We got a quick break here. I'll give you the final segment coming up in a moment or two when we come back after this. There's some people think it's so broken that you almost have to tear it all down and start up. And not only in the state of Mississippi, but where it all here. But I wanted you to give your final thoughts here in this segment. Anything that you wanted to mention? Can you hear me?
I can hear you fine.
Catch you off guard here. Let me preface this by saying that You guys got Rick Santorum coming in December?
Absolutely.
Is that still on schedule?
Yeah, we've got Rick Santorum coming in December. We've got the great education reform advocate, Cardi Angelis, coming in October.
October or December? It says here November.
Oh, sorry, November, yeah.
November.
And we've got Mark Mills coming in October, a former White House energy advisor. So we've got a very full speaker series in the fall. And obviously we've got the 2024 legislative session, not that far away. We've got the elections, obviously, between now and then. But we are very inspired by what Arkansas has done in terms of education reform. They have embraced full-on school choice in Arkansas, and we're looking very closely at how we can see what Arkansas has done and try and see if we can have something similar happen here in Mississippi.
I was encouraged by our visit yesterday with who will possibly be the next Speaker of the House, and that is on our guest yesterday. And just to hear him say, number one, that it's going to be a top priority as far as school choice, and number two, that he wanted to take a look and see if we can take care of CON in this next session. And that's something we've got to do, the certificate of need.
It's wonderful to hear the next speaker saying that. I mean, certificate of need really does need to be reformed. People in Mississippi are not going to get the health care they need without it. And it's also wonderful that a priority for him is education reform. You know, if we want Mississippi to be a state where young people stay and prosper rather than then move to neighboring states, we've got to fix our education system.
Well, he did say both of those two things, and I think that they'll be a top priority, and I hope they are, because the certificate of need, in some form or fashion, should have been gone a long time ago. But so much politics, so much lobby, and everything else goes into this that it's just it's either you're going to choose the future of the state or over your politics. Whether it's the flag or whatever happens, let it fall where it falls, but do what is right. And the certificate of need needs to go to the byways. When you look at the hospital situations, and I go back to your experience in Great Britain, is their system collapsing? Is it being eaten up with just people feeding off of it? Where's their health industry right now?
There are some people in Mississippi who look at the problems in the healthcare system and say, wouldn't it be great if we got the federal dollar and the taxpayer to pay for it? Trust me, the UK has had a system like that, the so-called National Health Service, and we've had it for half a century, and it is simply not working. Britain has a total population of 65 million people, and yet the number of people in the whole country on a waiting list to get urgent medical treatment is about 7.2 million. In other words, more than 10% of the country is waiting for medical care. It's really not a model to emulate. What you need to do is reform the system you have here in Mississippi by making it more competitive, by allowing new producers into the market.
Never understood that. I never understood why we don't do that. I understand a lot of the things that are dictated out of Washington, D.C., and certainly when you're, that beholding to Medicare and Medicaid, there's not much you can do.
If you simply expand the number of people on Medicare and Medicaid, all you do is lengthen the line of people waiting for limited healthcare. What you need to do is increase the number of providers. I really do understand there is a problem with rural hospitals, and I'm pleased to hear what the governor is now doing to tackle that. But the idea that somehow expanding Medicaid is going to save rural hospitals and solve their problem, that's just wishful thinking. You can't fix the problem using federal dollars. It simply won't work.
Well, when you hear people like Brandon Presley saying we use socialism for a good economic boost, go back and look at Amtrak or the post office and things such as that. It never works that way. Yeah. It just to hear people talk about, man, this is a good thing for the economy, is people's taxpayer money from other places coming in, and giving us an infusion, and it just scares the hell out of you.
Yeah, I mean, the federal government can't run the things it's meant to run effectively. They can't even maintain a fence on the southern border. The idea that they can run a healthcare system, it's not feasible.
I sometimes hope, at least I hold out hope, I'm an optimist, that there is a simple or a more simpler way to do this, and we're just not allowed to do it. And then some good guys are going to stand up sooner or later and take care of this and say, all right, here's the way we're going to go. But it seems like it's always in the future, and you can't get it done. Always a pleasure talking with you, sir.
Well, thank you so much for having me on.
You got it. Douglas Carswell, President and CEO of Mississippi Center for